Hey, I'm Dr. Joe Niamtu, LoveThatFace.com. I'm a double-boarded cosmetic facial surgeon in Richmond, Virginia. I do surgery from here to here, and I don't do boobs, bellies, or butts. I'm a teacher, an author, and a surgeon. So one of the things that I get asked a lot by patients and from all over the world on these YouTube videos is about the buccal fat pad. And the buccal fat pad is this structure in our cheeks that we have when we're born. And when you look at babies that have these real big, cute cheeks, a lot of that is buccal fat pad. One of the evolutionary situations for this structure is to help in nursing. And also, as we get older, it helps as a plane to glide between our muscles. However, it can get big and make us look older. And one of the confusions that a lot of people have, even some doctors, is, what exactly is the buccal fat pad? Where is it? What's the difference between that and the jowls? How do I know if I need to have it reduced? So there's a lot of urban legend there. So, and also, you hear people say, oh, you never take that, you never reduce that because later on in life, you're going to look hollow. That's not true. I've been doing this for decades. And first of all, the buccal fat pad is a big structure. It's actually all along the side of the face from the top to the jawline. And we never take out the whole thing. So, it's a reduction. Like anything else we do, it's a conservative reduction. So we're going to come back in a second here and kind of give you some tips about this. Tissue here that we would rather have up here, right? As we age, this descends and we just get thick. And these are referred to commonly as the jowl, okay? So the jowl tissue, what is that? Well, we gain some fat in that area, but basically it's the descent of all this skin, muscle, fat. Our skeleton shrinks. A lot of things happen in aging, and we get this fullness here, like a little ping pong ball, and that's what patients hate, okay? So if I were to do a facelift on this patient and not address her buccal fat pad, I would make everything look better, but are you able to see that little area there that is convex, that area there that is sticking out, that's her buccal fat pad. So she's still going to have prominence there and not going to be a full rejuvenation. One way you can tell about buccal fat pad on a lot of people is to push on it. And when you let go, it stays dimpled for a second and it comes out, just kind of like pushing in on a piece of foam. See how that does that? And if you do that on other parts of the face or the jowl, it doesn't do that. So on this particular patient, she's a great candidate for a facelift. It's going to do that. However, if I don't address this, it's not gonna be a total rejuvenation. So we're gonna reduce that from the inside of her mouth, and that will be pushed back, or you can reduce it from within the facelift as well. So very important, and it's a simple operation. And again, we're just reducing this part of it. We're not removing all the buccal fat that's in this area. And don't believe all those myths. It's a pretty simple procedure when done in competent hands. It's an easy procedure, and it's not going to make you hollow the rest of your life. All right, so looking at patients from the front, this is what squares off our face, and this really makes us look old. And this is in part buccal fat in this area. And if you just do this, it looks better, but you can still see you have this. Something else needs to be done there. And you can see how when I push that in, it takes a second for it to come out. So that's a combination of fat under the skin, and I think also descended in herniated buccal fat. And if the patient smiles, big smile for me, you can see how that rejuvenates the face. We always look younger when we smile. Now relax. But what she's doing is the same thing that the facelift is going to do, pulling that up. And again, I'll show you some patients that had large buccal fat and or jowls, and what a dramatic difference it can make when you do that combination procedure. So I hope that provided some education for you about the buccal fat pad. I appreciate your time. That's the best gift in the world. I'm Dr. Joe Niamtu, LoveThatFace.com.